Right, public goods. Now, for economists, public goods have a very specific meaning. It's got two characteristics. A good that is non-rival and non-excludable. Let's take non-rival first of all. If we say something's non-rival, we're saying that one person's consumption of the good doesn't mean there's less available for others. Now, if we go back to the apples and chocolates are rival. If I eat the apple, it's not available to you. If you eat the chocolate, it's not available to me. It's rival. On the other hand, we've got some spare seats in this room. So this lecture is non-rival. We could have additional people coming in, ideally at the start, and they could consume the lecture, and there's not less lecture for the rest of you. Okay, if they really wanted to ask lots of questions, it might begin to squeeze your opportunity to ask questions. But initially, it's non-rival. It could become rival, if too many people came, because then that would interfere with your consumption of the lecture. And the second characteristic is non-excludable. This is saying that if the good or service is provided for one person, it's impossible to prevent others from enjoying the benefits. Now, this lecture is excludable. It's not non-excludable because we just lock the door. Or there's other ways we do it. We just don't tell people it's happening. But we can prevent people. Just because I use enjoying in the sense of consuming. Just because you are consuming this lecture doesn't mean the benefits of the lecture are then available to other people. Mind you, if the recording goes on online without a firewall or something, a payment wall, I suppose maybe this also is non-excludable. Think about that. Probably it's on going to be on a Kyoto University website, in which case only members of Kyoto University will be able to access it. So you see the distinction, that some of the goods, if you provide it, it's easy to exclude other people from enjoying the benefit. Other goods, if you provide it, it's very difficult to exclude people from enjoying the benefits. Examples of non-rival, non-excludable. A traditional one is national defence. My government invests in national defence. They can't tell, choose your enemy. They can't tell Germany, they can't tell North Korea, they can't tell Russia, they can't tell the United States. John Cairns is not protected, by the way. Yes, we're going to defend the country, but we're not going to defend him. So by providing national defence, they provide it for me as well. They can't exclude me. Also, by providing national defence, the defence protection offered to 50 million people is the same protection offered to 60 million people. There's not less defence available in that sense. So that's why there's an argument national defence is non-rival, non-excludable. Perhaps a more mundane example would be street lighting. If you provide street lighting, it's non-rival in that there's not less, if I walk along the street, there's not less light available for other people. So it's non-rival. Also, it's pretty much non-excludable. If you're going to provide street lighting for one person, one group of people, other people can walk along the street and get the benefit. That's more mundane. A bit more esoteric, knowledge. Is knowledge non-excludable, non-rival? So if we discover something and we have new knowledge, there's not less available for other, and somebody wants to consume that information, there's not less available for other people to consume. Non-rival, is it non-excludable? Well, generally, once we discover something, unless we're going to somehow keep it a secret to ourselves, it's quite difficult to exclude others from the benefit. Now, I do realize in some societies, things like access to internet is more restricted than others, and in a sense, that might be seen as excluding people from the benefits of knowledge. But in many societies, knowledge seems to have this public good characteristic. Now, public goods have a particular problem, or a number of problems. One of them is called the free rider problem. It's quite difficult to provide public goods through markets because individuals don't have to pay. If someone is being provided and is going to pay for the good, other people will be able to enjoy the benefits of the good. So when we describe this as free riding, it's where people try and obtain the benefit without paying the cost or contributing to the costs. And so that makes it very difficult, not impossible, but quite difficult for private markets or markets to provide public goods. I've got some interesting counterexamples. And for many centuries, the lighthouses around the coast of the British Isles, which are there to warn shipping of rocks and shallow water, and so protect shipping vessels from harm. For many, actually centuries, the system was run entirely privately. It wasn't governmentally provided. It was a private organisation supplied the lighthouses. Now, the way they did it would be partly through contributions, well, just voluntary contributions, but also local communities, of course, got the most benefit from the lighthouse because that was in their area, and so there was a sort of willingness to contribute. Now, question to ask, of course, is, did we have too few lighthouses? Should we have had even more lighthouses? And we just had too few because we were relying on contribution just locally. But so that was an example of private organisation being able to provide what would be, I think, viewed as a public good. Bottom question here is, does healthcare have public good characteristics? Well, most healthcare actually appears to be rival and excludable. I break a leg, I get it fixed. I benefit from having the leg fixed. It's rival in that the time that the orthopedic surgeon spends on my leg is not available for somebody else, so it's rival. Also, fixing my leg sounds excludable. The hospital, maybe, I don't know what would happen in Japan, but certainly in the United States, in some parts, they would check my credit card first of all. And if I didn't have a credit card, or if I didn't have health insurance, maybe they wouldn't fix my leg. So I could be excluded. A lot of healthcare seems like that. Not all healthcare. I mean, if we think of infectious disease, protecting one or helping one individual, protecting one individual seem to confer benefits on others. Public health measures, I think, may have public good aspects. For example, prevention of a bird flu pandemic. There's not less protection from others if we provide protection for one group. There's not less protection available, so non-rival. And I think it's non-excludable. if you protect one group, that's definitely going to protect and confer a benefit on others. Another example, I suppose slightly rarer, is disease eradication. So, eradicating smallpox is a public good, non-rival, non-excludable. What about social capital? Are there externalities associated with individual investments in social capital? So if we do things in order to build up our social capital, we participate in more organizations, meetings, we trust others more. If we engage in these activities, is that going to provide a benefit to others? It seems quite possible it might. We looked at some evidence showing as various measures of social capital increased, there seemed to be some positive impacts on health. Question here is, were the impacts just on the person who was investing, or is the health gain more general? Or one way of phrasing it might be, is community social capital a public good? Is it non-excludable? Is it non-rival? Now, as social capital builds up in a community, it does seem that my or your consumption of that social capital could well be non-rival. And non-excludable. Now, if that is the case, that then leads to the final question. Is it likely that left to the market, too little social capital will be created? Because individuals might just be thinking of the benefit to themselves by contributing to the maintenance or development of social capital. They may not be thinking enough about the benefit they're conferring on other people. So it might well be the case that we should have, or there's an opportunity to benefit from some sort of governmental encouragement of social development of social capital. What do you think? Not so much should governments get involved. Let's take the prior question. If we leave it to individuals, individual firms, individual consumers to make the decisions, will we get the right amount of social capital, or will we get too little, too much? Yes.
An example, recently in China that we have that some company, they share the bicycles, provide the bicycle that is very, very cheap, but it's very convenient from their home to that subway station, that back to the city. I think that is related to market. Government did nothing, but maybe for some public parking that place. But I found that always gives them positive feedback of this thing. So I think it's not too little social capital.
Okay. Are you saying there's too many bicycles already? We don't need any more. So this is an example of private organisations taking actions, incur costs themselves, which will generate these benefits for others. Mm-hmm. Do they advertise on the bicycles and things like that? I guess they don't do it in secret. There wasn't 2,000 bikes appear overnight, and they keep quiet about it. But okay, so that's an example. So that might be an example. Yes, let's just leave it to the market.
I think the government can create an environment to facilitate growth of social capital.
Mhm.
the government can build the community social halls where people can have the opportunity to do the activities in the community.
Yeah, because something like that, okay, individuals could come together, and as it does happen, and each contribute and over the years develop the facility, but it's not always easy. And maybe, yes, there might be a role whereby government could provide the facility, and that'd be a much faster way and more effective way maybe of building things up. Mm-hmm. Okay. I didn't put that slide in the in the lecture. Sorry, in the lecture notes. It's an irritating thing lecturers do. We don't do it deliberately, but I was just looking over the notes this morning, and I thought, actually, given what I've been talking about, yes, Monday and Friday, I really should put a slide in here about this. I'm sorry. Yes, I just remembered. Okay, so in summary. What have we covered? Quite a lot, actually. I tried to explain why perfectly competitive markets produce optimal outcomes. I tried to explain some of the reasons why markets fail, or might fail. And maybe didn't put enough emphasis on this, we should have. It may be that markets for healthcare are particularly prone to failure. For example, problems with information or imperfect information may be greater in healthcare markets. Monopoly may be much more of a common phenomenon. If you think of hospitals, there's very few hospital markets, a few, where there are so many hospitals that effectively it's almost atomistic competition. Well, it's not. They've got market power. In some communities, there may only be one hospital in that locality. So monopoly might be an issue. Some parts of healthcare do seem to be characterised by externalities. And some aspects of health might have public good features as well. Now, there's different ways governments can respond to that. They can attempt to replace the market completely, or they can try and sort of work with the market, or they can have a dual provision. They can have a public health sector and a private sector. And I suppose the final thing I should say is it's very important to recognise that governments can fail and not just markets. So there's absolutely no guarantee that replacing markets with government actions and regulation will improve things. I think context will come into it. There are some governments that we might trust more than others to improve situations. So it's very important not to just say, okay, I see why markets might be a bad idea. We've got to use taxes more, we've got to use subsidies, we've got to regulate, we've got to publicly provide. But that still requires a whole series of decisions about quantities to provide, technologies to use, where to provide services. And can you be confident that some committee is going to make the decision in a much better way, more effective way, than leaving it to individuals and individual organisations? Which turns me to the lecture this afternoon. In several countries, one way government is regulating healthcare is by making decisions over which health technologies will be used, particularly around new drugs. Now, there's two ways in which they, at least two ways in which they strongly regulate this market. One is to do with assessing the safety of new products. And so we have, I guess, ministry in Japan making some decisions there. In Europe, we have something called the European Medicines Agency. And in the United States, you've got something called the Food and Drug Administration, or FDA. So one way governments regulate is by setting up these bodies, and if you're going to, in order to obtain permission to sell this new drug, you need to provide certain evidence and persuade certain committees that the likely benefits outweigh the risks. A second way in which governments in several countries, and beginning to a little bit in Japan, but not a lot, is not just looking at the safety of the new drugs and the relationship between benefit and safety, something called risk-benefit, but they also ask, is this a good use of resources? Because in many countries, the government is playing a major role in providing, through the taxpayer, but the taxpayer is playing a major role in financing what healthcare is provided. And the question is, are some of these new drugs good value for money or not? And if you're not going to just leave it to individual private decisions, if you're going to replace these private decisions as to what drugs are going to be available, you need some mechanism by which you decide. And so in this afternoon's lecture, I'm going to talk about two examples. I'm not going to focus too much on the mechanism. I'm going to talk about the use of economic evaluation to inform these decisions. And there's lots of different ways you can organize the processes, but in many countries, at any rate, one element is a detailed review of evidence. And evidence, not just clinical evidence, but also evidence on cost effectiveness. And we'll look at, as I say, two examples. We'll have a look a bit at hepatitis C and a bit more at some of the new treatments for non-small cell lung cancer. Okay? So that's resuming at 1 o'clock, isn't it? Yes. Okay.